We are meeting after I think 2-3 weeks. Uh, Busy that I was not able to conduct live sessions. I think for the next 1 month I will be conducting only Sunday live session here from 10 or 10:30 to 11:30, 1 hour. Uh, it may be 10 a.m. from 10 a.m. to 11 a.m. or 10:30 to 11:30, depending upon the circumstances. So the last uh, day we have discussed up to 144. Today 145 is actually the conclusion of drug proving. We have gone through each and every aphorisms of drug proving and their clinical applications. Refer just to freshen up your memory. Refer to those lectures previously. I think 2 or 3 lectures will cover up those drug proving aphorisms on drug proving. Many of you are in mid of exams. I know. Uh, if you have any doubt or any you need any help regarding your exams in any subject, you can contact me directly on WhatsApp or can call me. Okay. So 145, conclusion of drug proving. Give the heading, conclusion of drug proving. Of a truth, let me considerable store of medicine, accurately known in respect of these their pure mode of action in altering the health of the man, that we can place in position to discover the homeopathic remedy. Underline this. What is homeopathic remedy? A suitable artificial curative, in bracket curative, a suitable artificial morbific analog, a suitable agent which will produce artificial disease, okay, and which is analogous to the natural disease. This is homeopathic remedy. Underline these. Homeopathic remedy. What is homeopathic remedy here? Artificial morbific analog, artificial which will produce artificial morbific analog. For each what we are doing during the process of cure, as a homeopathic physician, we are matching this. This is natural disease and this is artificial disease. We are searching in our Materia Medica an analogous medicine, which is this. This is analogous. This is natural, this is artificial, and okay, it should be this analogous, mirror image, antitype. Now, for each of the infinitely numerous morbid states in nature, for each of the infinitely numerous morbid state in nature, for every malady in the world, for every malady in the world, there is a footnote. We will refer to that. Okay. In the meantime, even now, acha, what is happening here? The stock of remedy is very less. Hahnemann is foreseeing the future, that in future we may reach a mathematical certainty. Now we have more than 5,000 remedies, but during Hahnemann time there was hardly 100 remedies available to his discourse. So searching infinitely numerous natural state was there, and searching for each state a medicine was something means very difficult, was very difficult at that time. That is why Hahnemann is giving, when the you will see that when the store of medicine is very less, what to do from 100. I think that starts from 160 onwards, 160 onward, when the store of remedies, when the medicine is very less. Now in what uh, in what condition these are applied nowadays? Because every one of us are not using repertory, means computer repertory is having answer to each and every symptoms. What Mumbai School of Homeopathy is doing, they are basing their uh, whole treatment on the repertory, computerized treatment with the repertory. They are taking all the symptoms, putting it in computer and getting a medicine. This is somewhat they are doing, but what Calcutta school is doing, Calcutta school is more applying more the artistic side of homeopathy. Okay, not basing totally their prescription on repertory, but they are taking hints from repertory and now applying their artistic skill to discover or apply the medicine. So in present condition, how this can be happen, the number of medicines are huge, so many medicines are available, but not all we have learned by heart. We hardly learn and recognize hardly 40 to 60 medicines in our clinic. We are getting more often and we are more familiar with them. So this is one of the limitation of our our learning. It is impossible for a human brain to learn all 5,000 medicines. So this difficulty can be solved by repertory. But what I will advise, use repertory for only for the hint purpose, not mechanical symptom and fetching the remedy is not an ideal thing to do. So this was one difficulty we have dealt with later on, that when the number of medicines are, you have what you have to do. Okay, that is also an artistic, and we also use means doing that in our clinic. Cure, have you heard about that? The zigzag cure. Okay, not straight, the zigzag. Given one remedy, then some symptoms came, then another remedy, then some symptoms came. This is what happens in our clinic daily. But if by chance you discovered a similia, it will cure the case then and there. It is straight. Okay, both are homeopathic applications. Both can be used, but finding a simillimum is very difficult. That is why mostly in our clinic what is happening is zigzag cure. Okay, so in the meantime, even now, thanks to truthful character of the symptoms, underline this, truthful character of the symptom. In Allen's keynote, you will find a symptom is given in bold, but it is in clinic when you are using basing your prescription on that symptom, you are getting failure. Okay, what that indicates? That indicates there is some regarding that symptom, or there may be some mistake, though it is very less in older materia medicas. It is very less. Those stalwarts were very careful regarding noting down the symptom. Even if it is clinical, they will mention that this is a clinical symptom and I have found it, you may use it. So those stalwarts were very careful regarding the truthfulness of the symptom. Is this symptom have been seen in the proving, or is this symptom have been confirmed in the proving? That's how they were grading the symptoms or noting down the symptoms. Okay, so truthful character of the symptoms. Modern days materia medica are devoid of this truthfulness. Okay, they are just making conjectures. Now, and to abundance of disease element, which every one of the powerful medical substance has already shown in its action on the healthy body. But few diseases remain for which tolerably suitable homeopathic remedy may not met with among those proved as to their pure action. Underline this. Okay, due to the less number of medicine, due to the less number of some disease may be there, analogous homeopathic remedy may not be found. Okay, which without much disturbance restore health in a gentle, sure and permanent manner, infinitely more surely and safely than can be affected by all the general and special therapeutics of old allopathic medical art with its unknown composite remedies, which do alter and aggravate but cannot cure chronic disease. and rather promote recovery from acute disease. What he's telling from the very beginning, we have focused this, that in acute diseases there are some help with the antipathic medicine, there are some help with the allopathic medicines in acute diseases. From the very beginning, when we have started to read introduction, we have highlighted this point that never in acute disease Hahnemann have accused allopathic system of medicine for not giving help. They are giving help to such an extent that he is criticizing it rather very mildly in acute diseases, but homeopathy is only the now for chronic diseases. Only answer is homeopathy. Okay. And in sixth edition, and frequently endanger life, and frequently endanger life is added about after acute diseases. Now from 146 onward, third business starts. Write down when we have started aphorism number 71, I think. Enumeration was there. First business Roman 1, second business Roman 2, and third business. What was the third business? First business was to what is knowledge of in general, in particular. Was from this classification, and to that you can add the modern medicine, knowledge of practice of medicine, knowledge of surgical disease, knowledge of gynecology, included in knowledge of disease in general. Next came knowledge of disease in particular, that includes case taking. Number 2 was knowledge of medicine, knowledge of instrument intended to cure. We have told that these also have two parts, knowledge of medicine in general, knowledge of medicine in particular. In general means pharmaceutical parts, which Hahnemann dealt later on also after aphorisms, after aphorism number 260 onwards, I think. That is knowledge of pharmaceutical part, knowledge of medicine in general, knowledge of medicine in particular is proving each drug on healthy human prover healthy human prover, and getting its all the morbific elements it is capable of producing. Okay. Now this, how to apply this? Number third, this is the third business, and this is one of the most important part. What is the most suitable method of employing these artificial morbific agent? That has been discussed. What is the most suitable part? No, capable of producing opium is capable of producing. Now a patient is suffering from constipation, you can give opium. This is also an application of knowledge of medicine. Opium was able to produce diarrhea. A person is suffering from constipation. Now applying this opium to that will, what will happen? That will stop, that will release the constipation, relieve the constipation. So this is also a mode of application of knowledge of medicine in particular. Now a patient is suffering from diarrhea, you gave him opium, which you know by drug proving that it is able to produce diarrhea. Now this is this was diarrhea and this was diarrhea. You are applying. This is also application. This is also an application of your knowledge of particular medicine, knowledge of medicine in particular. So suitable, or I think that have been discussed before, 26, 27, 28, like that. In the chain, it has been discussed by Hahnemann. Application of medicine. Most suitable method is homeopathic application of medicine. Now, this is the third business, 146. The third point, you can underline and write here homeopathy margins. Okay. What is the most judicial employment is homeopathic employment. Okay. The third point of the business of a true physician relates to judicious employment. What is judicious employment? Homeopathic employment of the artificial morbific agent. See, three words are being used instead of one. Medicines. Okay. Artificial morbific agents, that is medicines, that have been proved on healthy individual to obtain their pure action in order to effect the homeopathic cure of natural disease. This is a single complex sentence. What you have to take from it, the third business is knowledge of application of medicine. Okay, what kind of application? Application was there, which I've given the in that idea. Okay, so judicious employment, kind of employment, it should be judicious. And what is it? Homeopathic. Now 147 deals with a specific remedy. I think we have dealt with a specific remedy in detail during the discussion of Organon of medicine, introduction of Organon of medicine. Okay, so no need to dwell upon this too long. So just we will read, and you refer to that previous lecture. Whichever of these medicines that have been investigated as their power of altering man's health, we find to contain in symptoms observed from the use of the greatest similarity to the totality of symptom of a given natural disease. Underline this. Greatest similarity first, comma, I encountered, and I'm out of my breath. So complex aphorisms of organons are. That is why we are trying to read. Great similarity to the totality of the symptoms of a given natural disease. Underline this. Okay. There are a lot of discussion on totality. What you call, we have discussed it before. So greatest similarity disease. Underline this. This medicine will, which medicine? Which is having the greatest similarity, which will and must be the most suitable certain homeopathic remedy. Underline this. Most suitable, most remedy for that disease. In it is found the especially of this case of disease. Remedy. The simillimum is a specific. I have narrated you a story from my own college day. We were attending a class of clinical class of surgery teacher, and he was prescribing thuja for prostatomegaly. Okay, enlarged prostate, thuja 30 or 6, like that. He was prescribing, and we asked, sir, why thuja? Like students used to ask directly, why thuja? He told us specific. Okay, we got an idea of specific. Oh, this is specific thuja in any case of prostatomegaly. Okay, and fortunately or unfortunately, on the same day we were having Organon of medicine class, and our revered teacher introduces us this aphorism or this specific remedy, discusses about a specific remedy in homeopathy, and we were totally confused what specific that our surgery teacher means by specific and the organon teacher means by specific. Totally confused. Oh, and that is slowly it was clear. That kind of confusion has been created in our mind, that what kind of a specific is this. So then after that we have learned that oh, organon examiner के सामने ये specific बोलना है, organon examiner के सामने कभी भी वो वाला specific नहीं बोलना है. But that specific do exist at some point of time, that we have dealt in previous lectures. I have shared with you the articles also regarding search of a specific from the time of Hippocrates to the Hahnemann and to ours time. Okay, so go to that lecture and go refer to those articles. Now 148 is nothing but modus operandi. You can write it here, 28, 29 to 82. 282 is also a modus operandi, and there was a paragraph in the introduction that was also modus operandi. Okay, no need to dwell on this. We have dealt with it again and again. 282 modus operandi, 29 modus operandi, and 148. Those who are giving their entrance examination, they can remember this. 148, 28, 29, rather 29 is the modus operandi, and 282. Okay, now this aphorism number 148, 6th edition, contains a footnote. 149 contains a footnote which has been shifted to 148 in the 6th edition. Same footnote. So we will read it here. We will read it in 149. Okay. Write it down. Time taken for cure. We have referred this aphorism again and again before also. Time taken for cure. Okay. Now, when the suitable homeopathic remedy has been thus selected. Okay. Has been thus selected. What is happening? Go to 104. 104. Aphorism number 104. When the totality of symptoms that specially mark and distinguish the case or disease, or in other words, when the picture of disease, whatever be its kind, is once accurately sketched, the most difficult part of the task is accomplished. First, what you are doing a case taking, sketching the portrait of disease. Okay. Now, what you will do, you will select a medicine. Okay. How? By your knowledge of materia medica. By analogous symptoms, you will, depending upon the analogous symptom, you will select a medicine. Okay. Now, when the suitable homeopathic remedy thus has been selected, what will happen next? Selection हो गया, अब दे दिया, and rightly employed. Okay, and rightly employed, this rightly employed needs some explanation. Rightly employed in doses, rightly employed in potencies, rightly employed in homeopathic similarity. Okay, sketched, portrait sketched by case taking, selected and rightly employed. Okay, sketched, selected, rightly employed. Underline this. Thus selected, and what is this selection needs? That is the footnote. What this selection needs? Footnote. Just go through footnote, but this laborious, sometimes very laborious. Okay, which laborious? This selection, you have sketched the case taking, half work done. Now you have to select, and this is a laborious work. This laborious, sometimes very laborious. Search for the selection of homeopathic remedy most suitable in every respect to each morbid state is an operation which, notwithstanding all the admirable books for facilitating it, now the computers to facilitate it. Okay, now the computers are there to facilitate. Still, what books Hahnemann is talking about? Hahnemann is talking about the repertory available at that time. Okay, still demands the study of the original sources themselves. Okay, I have stimulated you to read something from the provings, original sources. Okay, themselves, and at the same time a great amount of circumspection, underline this, and serious deliberation. Okay, long continued consideration a serious deliberation whether to give or not, whether to give it or not, like that, which have their best reward in the consciousness of having faithfully discharged our duty. Okay, will be a we will be satisfied that I have selected medicine with all my knowledge and all my uh, whole of my existence. I have selected it. How could this laborious, care demanding task, by which alone the best way of curing disease is rendered possible, please the gentlemen, what is mongrel sect? That is hybrid, a way of animals abuse, who uh, who assume the honorable name. This is often a short note for your uh, written examination, especially in especially in the this university BHMS examination. New mongrel sect, who assume honorable name of homeopathists and even seem to employ medicine in form and appearance of homeopathic, but determined upon by them anyhow, quid in convenit. This is a Latin proverb which means says whatever comes in mouth. Says whatever comes in mouth. Okay. Okay. So these are all the galagali of Hahnemann. You need not to dwell upon it more. Just this underline this line. 1, 2, 3, 4, 5. Fifth line from there. Doesn't spontaneously fly into their mouth like roasted pigeon. Doesn't spontaneously fly into their mouth like roasted pigeon. Okay, this is a laborious task, and it is not that easy that you will get a medicine easily. So you are thinking to give some homeopathic along with allopathic medicines. This is mongrism. Okay. Now, and rightly employed, the acute disease we wish to cure, and rightly employed. Okay, the acute disease we wish to cure, even though it be of a grave character and attended by many sufferings, subsides insensibly in a few hours if it be resented. Underline this, some hours if it is of resented, few days if it is of somewhat longer standing. Underline this. So time taken, rapidity we have discussed. That rapidity is directly proportional to the duration of disease and directly proportional to the if the patient is in coma due to blood loss, it will take more time, though it is acute disease of blood, acute condition of blood loss, but the vital force has sunk to that extent that it needs time to recovery. So, and where it was in preface to fifth edition. Preface to fifth edition, two things we have underlined with in respect to rapidity. Okay, we have told a migraine of 6-month duration can be cured in 6 days or 16 days, but a migraine of 6 years duration cannot be cured in 6 days. Okay, it needs 6 months, and even if you are treating it in 6 months, that is rapidity depending upon the duration of disease. Okay, so rapidity directly proportional to the duration of disease. Okay, now along with all traces of indisposition, and nothing or almost nothing more of artificial medicine is perceived. Okay, there may be you are applying medicines, there may be some accessory symptoms of medicine, but if your selection is correct, those accessory symptoms will not be perceived. There occurs by rapid, imperceptible transition, nothing but restored health. What is cure? What is cure? Go to Mathematica Pura, chapter China, and in the introduction, you will get the definition of cure. If anyone asks you the definition of cure, you can tell that recovery undisturbed by after suffering. What is the reference? Mathematica Pura, chapter China, introduction, recovery undisturbed by after suffering. Okay, nothing but restored health, recovery. Acha. Here ends the first sentence. Now, second sentence, disease of long standing, and especially such are of a complicated character. Underlying disease of long standing require for their cure a proportionally longer time. Underline, proportionately longer time. More especially, do the chronic medical dyscrasia so often produced by allopathic bungling along with the natural disease left uncured by it require a much longer time for their recovery. Okay, patient is coming to you after lots of allopathic treatment that has produced a masked disease over the chronic, natural chronic disease that obviously will require much longer time for their cure. That is why people in general saying that homeopathy is slow in action. No, your bungling have made it slow. Allopathic, with the allopathic medicines, your bungling have make the recovery process slow, because you have to deal with the mask first, then you will start the treatment of the natural disease. Okay, many often the vaccine damaged children, means too much vaccination. After too much vaccination, child is coming to you suffering from recurrent cold and cough, recurrent breathing distress, asthma, this and that, and you know that there is the cover of vaccination you have to remove first. Okay, that vaccination cover you have to remove first, then you will go to natural disease. And most often it happened that there was only one disease, and that was vaccinosis. Okay, give your thuja in repeated dose and child will recover from that. Okay, or any other indicated medicine, most often thuja will come, still thuja will come. Okay, most of the Western homeopaths are telling that no, modern days vaccination is during Barnett's time, the vaccination was something else. The that was using different technique, but modern days vaccinations are made up of RNA, are made up of DNA or some other particles like that. So the thuja is not effective for these kind of bad effect of vaccines. But in my clinic, I am finding that yes, thuja is still a very good medicine to scratch this mask of vaccines. Okay, even you will see patient who are taking tetanus toxoid. Okay, for every now and then a prick, and they will go and take a tetanus, a cut, and they will go take a tetanus injection. Okay, that is a normal thing in general public. This tetanus toxoid has created a mask over that person. Okay, don't forget to ask your patient how many times you are vaccinating yourself for tetanus. Okay, especially if they are in some occupation or some profession where they are suffering from recurrent injuries or recurrent cut. They won't take tetanus for a laceration, but a cut, it has been set in the mind of public that there is a cut and you have to take tetanus. I have seen patients who are taking tetanus for 50 times a year. Okay, so my medicine was not working in that. Finally, I started with this theory of vaccinosis and the medicine started to work. Okay, so, and especially the dog bite. Okay, the ARV is very necessary vaccine. You have to advise your patient to take regarding tetanus. You have to advise that until and unless there is no deep cut, you should not take. There should be a deep cut to deep unclean cut will produce unhealthy reaction in the body, which may lead to tetanus. But for ARV, only the dog bite, which the dog which is not vaccinated should be, anti-rabies vaccination should be taken, and this is very necessary because the rabies, once rabies develop, there is no cure. Okay, even in homeopathy it is very difficult. There are very less number of cured cases of rabies are in record, even with homeopathy. Okay, for cases on record you can refer to H.C. Allen's Nozodes lysine. Okay, and there he have discussed some cases of rabies cured with that. So this ARV is very necessary evil you have to give. But one person have been bitten by thrice or 4 times by a dog and have taken ARV. You have to take every time he is being bitten by a dog. So this ARV has prevent him from going into running down to rabies, but it has created a vaccine shield which you have to scratch before you start your treatment. Okay, and Thuja is most often a medicine. During my PG days, I was working on a project. Unfortunately, it was not completed. I have collected around 10 to 15 cases of bad effect of anti-rabies vaccination. Managed with homeopathy. Okay, it was not published or not completed. Work was not completed. Somehow my PG completed there. So that was the day I was I have learned most of the thing regarding these artificial diseases. Now, natural these kind of artificial diseases of modern days needs proportionately longer time. Steroid for long duration. What is the treatment for rheumatoid arthritis? They have no treatment for rheumatoid arthritis. Rather, they will start on giving steroid. What steroid will do? It is an autoimmune disease. Every now and then there are many autoimmune disease. Rheumatoid arthritis is one of them, and they will start with a steroid, a low dose, mild steroid, and they will go on with it, increasing the dose. So that rheumatoid arthritis already a complicated natural disease, a destructive natural disease. Now, above all, there is steroid. Okay, so you cannot expect an easy cure for this. Proportionately longer time is needed for these kind of cases. Now, OCPs. We have read in our PSM that OCPs are very safe and this and that, but no, it is not safe. For more than 1 year of use, if you are advising patient to take OCPs, you are doing a crime. Okay, 1 year is somehow okay for 1 year, but if the patient have planned for 5 years, plan for 8 years, and you are advising every time you are seeing ads on television that जब भी आपको फैमिली प्लानिंग करना हो तो ये बंद कर दीजिए, बहुत आसान है. But this is not the thing. This is OCPs are external hormones creating some trouble in the body. Okay, so one of the medicine for bad effect of OCP is thyroidinum. Other medicine is Aristolochia, clemitis. Aristolochia, clemitis is one other medicine. For thyroidinum, I use in LM potency 0/1, and for Aristolochia, I use 6, 30, 200 like that. And what are the symptoms of Aristolochia? Aristolochia will have a complex symptom. Means this OCPs will produce a syndrome in the patient, which will be like somewhat like pulsatilla, somewhat like sepia, and somewhat like arnica. Okay, it is actually written in the book. I have read a lot. I forgot the name of the book. I will share the name of the book, and that person is actually a psychologist, student of Carl Jung, and he was a psychologist turned homeopathy. He have advised that this Aristolochia, clemitis could be a polycrest in future. Okay, so best use of this aristolochia I'm seeing in bad effect of OCPs. Bad effect of OCPs, you can think of nux vomica, you can think of Hepus as we have previously stated, nux vomica, Hepus, and more specifically thyroidinum and aristolochia. Okay, so these are some of the common artificial next. So diseases require for their cure a proportionately longer time. More especially do the chronic medical dyscrasia so often produced by allopathic bungling, along with the natural disease left uncured by it. Allopathic medicine never can cure the natural chronic disease. Require much longer time for their recovery. Underline this. Much longer time for their recovery. So you are able to tell your patient that this is the case and this long you have to take medicine. Okay. Often indeed are incurable. Often indeed are incurable. Underline incurable. In consequence of the shameful robbery of the patient's tent and juice, the principal feat performed by allopathy in its so-called method of treatment. Underline this. Okay. Now, this is the time taken for the cure, and we have discussed somewhat the artificial disease that we have first introduced ourselves to that artificial disease, masked venereal disease. Okay, masked venereal disease and the modern forms of those masked venereal disease. Now, 150 is nothing but indisposition. What Kent have said, it slight mimicking sickness by Kent, and slight ailment. If you go to content, you will see that it has been referred as slight ailment. Go to content. Got it? 150. The slight ailment. Okay. Now, if a patient complains of one or more trivial symptoms, in this position we have dealt it before, that have been only observed a short time previously. Underline this. The physician should not regard this as a fully developed disease that requires serious medical aid. A slight alteration in the diet and regime will usually suffice to dispel such an indisposition. Underline this. This is 150. 151. This was 150. Okay. Slight ailment. A trivial symptom, some trivial symptoms, sometime before this cannot require a serious medical aid. Do not require a serious medical aid rather. 151. But if the patient complain of a few violent suffering, underline this, the physician will usually find on investigation several other symptoms beside trivial. It was trivial, now the violent sufferings. Okay. Now some acute disease erupts like volcano, suddenly, violently. Okay, this is also, there is a concept of pace of disease. Okay, how the disease, what is the pace of the disease to develop? If it is suddenly, violently, you can think of aconite, belladonna. Okay, if it is slowly, gradually, you can think of bryonia. Okay, read Kent Bryonia chapter, lectures on Mathematica by Kent, chapter Bryonia. You will get this concept that bryonia is slowly developing. Child was exposed to cold 3 days before, and he was something ঝিমঝিমি লাগছে, এরকম লাগছে, ওরকম লাগছে, and after 3rd day the child goes into fever. That is development of bryonia. But this development of aconite, what is written? Sudden. Development of belladonna, sudden and violent. Okay, so according to pace of disease, where you will find this pace of disease, there is a Mathematica by E.A. Farrington. E.A. Farrington, Mathematica. You will find there pace of every medicine. The pace of medicine have been mentioned there. Okay. Previously, I was thinking just developing medicine, but there it is written it is a sudden pace is sudden for gelsemia. Pace of medicine, but it is often helpful, especially in cases of aconine brainia. Okay, so you can choose your remedy by the pace of disease development. So that was a side topic we have discussed. But if the patient complain of a few violent sufferings, if the patient is complaining of few violent suffering, the physician will usually find on investigation several other symptoms besides. Okay, patient is complaining of violent sufferings. খুব জোরে ব্যথা হচ্ছে, মাথায় খুব জোরে ব্যথা হচ্ছে, কিন্তু when you have investigated, you find that abdomen is tender, you find that all these are the finding during investigation. শুধু মাথায় ব্যথার সঙ্গে অনেকগুলো আর symptom তুমি পেতে পারবে. Okay, the physician will usually find on investigation several other symptoms besides, although of a slighter character, which furnishes a complete picture of disease. Okay, 152. The worst of the acute disease is of so much more numerous and striking symptom. It is generally composed. Underline this. A recent case of a patient contacted me on phone that she suffered from this diarrhea, vomiting, headache, body ache, and fever, violent fever. All those numerous symptoms were there. I knew from the beginning that the case is not going to be an easy one, because this is a worst kind of acute symptoms she is giving. Okay, so I was prescribing medicines. First came Rastox, then came Epicac, then came Nux vomica, then came arsenic. Finally, arsenic was means to some extent arsenic 200, then arsenic 1m. These kind of acute diseases will require much more medicines. Okay, maybe there was a prejudice over phone that I was unable to prescribe the right medicine from the very beginning. But I think even if I could have seen the case, I would not be able. The case was not able to respond to one medicine. It needs several medicine during the time of cure, during the whole time. Okay, see, these kind of acute cases, be very conscious. Okay, if the patient is not very much trusting you, refer the patient to allopathic physician. Because if you are getting these violent symptoms, numerous violent symptoms, if there was headache and fever, this is a milder acute case. But these are so many numerous symptoms are present, be very careful. Okay, this is not going to be an easy one. In acute diseases, what I find that if these numerous symptoms are present, the patient will require numerous consultation during the course of time. Okay, so the worse of the acute disease, of so much the more numerous and striking symptoms is it generally composed, but with so much more certainty may a suitable remedy for it be found, if there be sufficient number of medicines known with respect to their positive action to choose from. Among the list of the symptoms of many medicine, it will not be difficult to find one from the mirror image antitype of curative artificial natural disease may be constructed, and such is the desired remedy. Underline this. Okay, now 153 is important. We will start from here next time. Okay, from next class onward, we will start from here. If you are having any question, you can ask. 153. We will start from here. This is regarding PQRS. Okay. I hope I will take next class on Sunday, next Sunday. Quite be not been possible is not conduct live class on Wednesday. I will try and conduct for next few Sundays live classes on Sunday only, next few weeks. Okay. Thank you for your attention. You can ask me on WhatsApp or you can call me regarding your, many of you are going through university examinations. So best of luck for your university examinations, and you can ask regarding any subject you are having